Top 30 Clinical Psychologist Interview Questions and Answers. Below is a comprehensive list of the top 30 clinical psychologist interview questions along with concise, 80-word answers tailored to demonstrate expertise, empathy, and professionalism. These questions cover a range of topics, including clinical skills, ethical considerations, therapeutic approaches, and professional development. The answers are designed to reflect the qualities employers seek in a clinical psychologist, such as strong communication, critical thinking, and a client-centered approach. This guide aims to help candidates prepare effectively for interviews in this rewarding field. 1. Can you describe your experience as a clinical psychologist? I have 5 years of experience providing therapy to diverse populations, addressing issues like anxiety, depression, and trauma. I utilize evidence-based approaches such as CBT and DBT, tailoring interventions to client needs. My work includes conducting assessments, developing treatment plans, and collaborating with multidisciplinary teams. I prioritize empathy and cultural sensitivity, ensuring clients feel heard. My supervised training and licensure have equipped me to handle complex cases while maintaining ethical standards and professional growth. 2. How do you approach building rapport with clients? Building rapport begins with active listening and genuine empathy. I create a safe, non-judgmental space by validating clients' feelings and experiences. Using open-ended questions, I encourage them to share their stories. I adapt my communication style to match their preferences, whether direct or gentle, and incorporate cultural sensitivity. Small gestures, like maintaining eye contact and reflecting their emotions, foster trust. Consistently showing respect and reliability strengthens the therapeutic alliance, which I monitor and adjust as needed. 3. What therapeutic approaches do you use most often? I primarily use cognitive behavioral therapy, CBT, and dialectical behavior therapy, DBT, as they are evidence-based and versatile for addressing anxiety, depression, and personality disorders. I also integrate mindfulness-based techniques and psychodynamic principles when appropriate, tailoring approaches to each client's needs. For trauma, I employ EMDR when suitable. My approach is flexible, ensuring interventions align with client goals, cultural backgrounds, and presenting issues, while regularly evaluating progress to adjust strategies as needed. 4. How do you handle a client who is resistant to therapy? When encountering resistance, I first explore its root causes, such as fear, mistrust, or misunderstanding of therapy. I build trust through empathy, validating their feelings without judgment. I use motivational interviewing to align therapy with their goals, helping them see its relevance. Adjusting my approach, like using less directive methods, can reduce defensiveness. I remain patient, flexible, and collaborative, ensuring the client feels in control while gently encouraging engagement and commitment to the process. 5. How do you assess a client's mental health needs? I conduct a thorough biopsychosocial assessment, gathering information on the client's history, symptoms, and current functioning through interviews and standardized tools like the PHQ-9 or GAD-7. I explore biological, psychological, and social factors, considering cultural and environmental influences. Collaborating with the client, I identify their goals and strengths. This holistic approach ensures a comprehensive understanding, guiding the development of a tailored treatment plan that addresses their unique needs while monitoring progress and adjusting as necessary. 6. How do you stay updated on clinical psychology research? I stay current by regularly reading peer-reviewed journals like Journal of Clinical Psychology and attending conferences hosted by the APA. I participate in professional development workshops and online courses to deepen my knowledge of evidence-based practices. Engaging in supervision and peer consultation also keeps me informed of emerging trends. I follow relevant accounts and psychology blogs for real-time updates, ensuring I integrate the latest research into my practice to provide effective, informed care to clients. 7. How do you manage stress and prevent burnout? To manage stress, I practice self-care through mindfulness, regular exercise, and maintaining a healthy work-life balance. I engage in supervision and peer support to process challenging cases. Setting realistic boundaries, such as limiting caseloads and scheduling breaks, helps prevent burnout. I reflect on my values to stay connected to my purpose as a psychologist. By prioritizing personal well-being and seeking professional support when needed, I maintain resilience and provide high-quality care to my clients. 8. Can you describe a challenging case and how you handled it? A client with severe PTSD presented with dissociation and mistrust. I used a trauma-informed approach, prioritizing safety and rapport through empathy and consistency. I integrated EMDR and grounding techniques, adjusting the pace to avoid overwhelm. Collaborating with a psychiatrist ensured medication support. Regular supervision helped me navigate countertransference. Over time, the client's symptoms reduced, and they reported improved functioning. This case reinforced the importance of patience, flexibility, and a strong therapeutic alliance in complex cases. 9. How do you handle ethical dilemmas in practice? When facing ethical dilemmas, I adhere to the APA ethical principles, prioritizing client welfare and autonomy. I consult the code of ethics, seek supervision, and discuss with colleagues to gain perspective. For example, in cases of potential harm, I assess risk thoroughly and follow mandated reporting guidelines while maintaining transparency with the client when possible. Documenting decisions and rationales ensures accountability. By balancing ethical obligations with empathy, I navigate dilemmas while upholding professional integrity and client trust. 10. How do you approach cultural competence in therapy? Cultural competence is central to my practice. I educate myself on clients' cultural backgrounds through research and training, ensuring sensitivity to their values and experiences. I use culturally adapted interventions and avoid assumptions by asking open-ended questions. Reflecting on my own biases through supervision helps me maintain humility. For example, working with a client from a collectivist culture, I integrated family dynamics into therapy, fostering trust and relevance, ensuring interventions align with their worldview and needs. 11. How do you measure therapeutic progress? I measure progress by setting clear, client-centered goals during the initial assessment. I use standardized tools like the Beck Depression Inventory or session feedback scales to track symptom changes. Regular check-ins with clients ensure their perspective is included, assessing improvements in functioning, relationships, or coping skills. Qualitative feedback, like client-reported confidence, complements quantitative measures. I adjust interventions based on data and client input, ensuring therapy remains effective and aligned with their evolving needs. 12. How do you handle a crisis situation with a client? In a crisis, I prioritize safety and stabilization. I assess risk using structured tools and clinical judgment, addressing immediate concerns like suicidality or harm. I employ de-escalation techniques, such as grounding exercises, and collaborate with the client to create a safety plan. If needed, I coordinate with emergency services or support systems while maintaining confidentiality. Post-crisis, I debrief with the client, adjust the treatment plan, and provide follow-up support to ensure ongoing stability and care. 13. How do you collaborate with other professionals? Collaboration is key in multidisciplinary settings. I communicate clearly with psychiatrists, social workers, and other professionals, sharing relevant client information while respecting confidentiality. Regular case conferences ensure aligned treatment goals. For example, I worked with a psychiatrist to adjust a client's medication while providing CBT, improving outcomes. I value diverse perspectives, actively listen, and contribute psychological insights. Documenting interactions and maintaining professionalism fosters effective teamwork, ensuring holistic care that addresses all aspects of a client's needs. 14. How do you adapt therapy for children or adolescents? When working with children or adolescents, I use age-appropriate techniques like play therapy or art-based interventions for younger clients and CBT or DBT for teens. I engage parents or guardians to understand family dynamics while respecting the child's autonomy. Building trust through games or relatable language fosters engagement. I tailor interventions to developmental stages, addressing issues like peer pressure or trauma. Regular feedback from the child and family ensures therapy remains relevant and effective for their unique needs. 15. What is your experience with group therapy? I've facilitated group therapy for issues like anxiety and substance use, Using structured formats like CBT-based groups, I create a safe, inclusive environment by setting clear group norms and encouraging mutual respect. My role involves guiding discussions, managing dynamics, and ensuring equal participation. I assess group cohesion and individual progress through feedback and observation. For example, a social anxiety group I led showed improved confidence through peer support, highlighting the power of shared experiences in therapeutic settings. 16. How do you handle confidentiality breaches? If a confidentiality breach occurs, I act swiftly to mitigate harm. I assess the breach's scope, informing affected clients transparently while maintaining professionalism. I follow APA guidelines and legal requirements, consulting supervisors or legal counsel if needed. To prevent future breaches, I review and strengthen protocols, such as secure record-keeping or encrypted communication. I educate staff on confidentiality importance and implement training. By addressing breaches promptly and ethically, I maintain client trust and uphold professional standards in practice. 17. How do you approach treatment planning? Treatment planning starts with a comprehensive assessment of the client's needs, strengths, and goals. I collaborate with the client to set smart, specific, measurable, achievable, relevant, time-bound goals. Using evidence-based approaches like CBT or DBT, I tailor interventions to their diagnosis and preferences. I incorporate cultural and environmental factors, regularly reviewing progress with the client and adjusting the plan as needed. Clear documentation ensures continuity, and I involve multidisciplinary teams when appropriate to enhance outcomes. 18. How do you manage countertransference in therapy? I manage countertransference by maintaining self-awareness through regular supervision and reflective practice. Recognizing personal reactions to clients, I explore their origins in supervision to avoid impacting therapy. For example, a client's anger once triggered frustration, which I processed with a supervisor to stay objective. Journaling and mindfulness help me separate personal feelings from professional duties. By addressing countertransference proactively, I ensure it enhances therapeutic insight rather than hindering the client's progress or the therapeutic relationship. 19. What is your experience with psychological assessments? I have extensive experience conducting psychological assessments using tools like the MMPI, WAIS, and Rorschach for diagnoses such as depression, ADHD, and personality disorders. I administer, score, and interpret results, integrating clinical interviews and collateral information. My reports are clear, evidence-based, and tailored to guide treatment or accommodations. I ensure cultural sensitivity and client comfort during assessments. Regular training keeps my skills current, enabling accurate diagnoses and recommendations that support client care and therapeutic planning. 20. How do you handle clients with suicidal ideation? I approach suicidal ideation with urgency and care, conducting a thorough risk assessment using tools like the Columbia Suicide Severity Rating Scale. I establish safety through empathetic listening and collaborative safety planning, involving support systems when appropriate. If risk is high, I follow protocols for hospitalization or crisis intervention while maintaining client dignity. Post-crisis, I focus on underlying issues like depression, using CBT or DBT, and monitor progress closely to ensure ongoing safety and stabilization. 21. How do you incorporate family in therapy? Incorporating family begins with assessing their role in the client's life and obtaining consent. I use family systems therapy or psychoeducation to address dynamics and improve communication. For example, with an adolescent client, I involved parents to reinforce coping strategies at home. I balance individual and family sessions to respect the client's autonomy while fostering support. Cultural factors guide my approach, ensuring interventions align with family values, enhancing therapeutic outcomes through a collaborative, systemic perspective. 22. What motivates you to work as a clinical psychologist? My motivation stems from a passion for helping individuals navigate mental health challenges and achieve meaningful change. Witnessing clients' resilience and growth inspires me daily. I value the opportunity to apply evidence-based practices to alleviate suffering and empower clients. Continuous learning through research and supervision fuels my professional drive. The privilege of building trusting relationships and contributing to clients' well-being aligns with my commitment to compassion, making this career deeply fulfilling and purposeful. 23. How do you handle disagreements with colleagues? I approach disagreements professionally by fostering open communication and mutual respect. I listen actively to understand their perspective, then share my viewpoint calmly, supported by evidence or clinical rationale. For example, in a case discussion, I resolved a treatment plan conflict by proposing a compromise informed by research. If needed, I seek supervision or mediation to ensure client care remains the priority. Collaborative problem-solving strengthens teamwork, ensuring disagreements enhance rather than hinder professional relationships. 24. How do you approach supervision and feedback? I view supervision and feedback as essential for growth. I actively seek constructive input from supervisors and peers, using it to refine my skills and enhance client outcomes. In supervision, I present cases thoroughly, asking targeted questions to address challenges. I integrate feedback by reflecting on my practice and implementing changes, such as adjusting interventions based on supervisor suggestions. This openness strengthens my competence and confidence, ensuring I provide high-quality, ethical care while continuously improving as a psychologist. 25. What is your experience with teletherapy? I have 2 years of experience providing teletherapy, using secure platforms like Zoom to deliver CBT and DBT for anxiety and depression. I adapt interventions for virtual settings, ensuring engagement through interactive tools like shared screens for worksheets. I address challenges like technology issues by preparing backup plans and educating clients on platform use. Regular feedback ensures therapeutic alliance remains strong. Teletherapy's flexibility has expanded access, and I stay updated on best practices to maintain effectiveness. 26. How do you manage time and caseloads effectively? I manage time by prioritizing tasks and using scheduling tools to balance client sessions, documentation, and professional development. I set realistic caseload limits to ensure quality care, typically 20 to 25 clients weekly. I allocate specific times for administrative tasks, like note-taking immediately after sessions, to stay organized. Regular self-assessment and supervision help me monitor workload and prevent burnout. By maintaining clear boundaries and efficient workflows, I deliver consistent, high-quality care while meeting professional responsibilities. 27. How do you approach clients with personality disorders? Treating personality disorders requires a structured, empathetic approach. I often use DBT for borderline personality disorder, focusing on emotion regulation and interpersonal skills. For narcissistic or antisocial traits, I employ schema therapy to address underlying patterns. Building a strong therapeutic alliance is key, using validation to reduce defensiveness. I set clear boundaries to maintain a safe environment. Regular supervision helps me navigate complex dynamics, ensuring consistent progress while adapting interventions to the client's unique needs and strengths. 28. How do you ensure client-centered care? Client-centered care starts with active listening and validating the client's experiences. I collaborate with them to set goals that reflect their values and priorities. Using evidence-based practices, I tailor interventions to their needs, cultural background, and preferences. Regular feedback sessions ensure their voice guides the process. For example, I adjusted a treatment plan based on a client's cultural beliefs, enhancing engagement. By prioritizing autonomy and empathy, I foster trust and empower clients throughout their therapeutic journey. 29. How do you address noncompliance with treatment? I address noncompliance by exploring its causes, such as lack of motivation or external barriers, through empathetic dialogue. Using motivational interviewing, I align treatment with the client's goals to increase buy-in. I adjust interventions to be more engaging or accessible, like incorporating client interests. For example, with a non-compliant teen, I used art-based activities to boost engagement. Regular check-ins and flexibility ensure the client feels supported, fostering adherence while respecting their autonomy and unique challenges. 30. What are your long-term professional goals? My long-term goals include deepening my expertise in trauma-focused therapies like EMDR, and expanding my work with underserved populations. I aim to pursue board certification in clinical psychology and contribute to research on culturally adapted interventions. I plan to mentor early career psychologists, sharing knowledge through supervision or teaching. By staying engaged with professional organizations like the APA, I hope to advocate for mental health policy changes, enhancing access and quality of care for diverse communities. This compilation of 30 clinical psychologist interview questions and answers equips candidates with the tools to articulate their skills, empathy, and ethical commitment effectively. By preparing thoughtful, tailored responses, aspiring psychologists can confidently navigate interviews, showcasing their ability to provide client-centered care. These insights, grounded in evidence-based practices and real-world application, prepare candidates to excel in the dynamic field of clinical psychology, fostering meaningful connections and impactful outcomes in mental health care.